A little fall is a big worry for seniors and the elderly, provided by Safe at Home Healthcare Community Educational Series. When seniors fall, consequences can be very serious, both to the senior and to their families. A fall can lead to injury, which can be sometimes fatal, and this signals the beginning of the end for seniors' independence. How big is the problem? More than 1/3 of adults 65 and older fall each year in the United States. Among older adults, falls are the leading cause of injury deaths. They're also the most common cause of non-fatal injuries and hospital admissions for trauma. In 2005, 15,800 people 65 and older died from injuries related to unintentional falls. About 1.8 million people 65 and older were treated in emergency departments for non-fatal injuries from falls, and more than 433,000 of these patients were hospitalized. The rates of fall-related deaths among older adults rose significantly over the past decade. According to the American Academy of Orthopedic Surgeons, they say that seniors, they want to keep living in their own home, but they say it starts by keeping her on her feet. Did you know that 70% of accidental deaths in people over the age of 75 result from falls? In 2000, direct medical costs totaled $179 million for fatal falls and $19 billion for non-fatal fall injuries. That 40% of all nursing home admissions are attributed to repeated falls at home. Did you also know that 1 out of every 3 seniors who lives independently in their own homes will experience a major fall each year? The likelihood of falling if you are over 75 is even much greater. That 75% of seniors who suffer hip fractures die within 1 year. And men are more likely to die from a fall. After adjusting for age, the fall fatality rate in 2004 was 49% higher for men than for women. Women are 67% more likely than men to have a non-fatal fall injury. Did you also know that survivors of falls may experience debilitating fractures of the hip, wrists, or spine? And finally, did you know that falling, or the fear of falling, oftentimes leads to the loss of confidence, imposed isolation, and immobility? Elder Fall Prevention Act of 2002. A national approach to reducing elder falls, which focuses on the daily life of senior citizens in residential, institutional, and community settings, is needed. The approach should include a wide range of organizations and individuals, including family members, healthcare providers, social workers, and employers, and others. Reducing preventable adverse events, such as elder falls, is an important aspect to the agenda to improve their safety. The definition of a fall is arising when stability is perturbed and there is inappropriate correction. External factors to falls: 4 or more medications that they're taking, poor lighting. Internal factors: slowed reflexes. As we age, our reflexes get slower. Balance disorders, weakness and tightness in the muscles, low blood pressure, orthostatic hypotension, visual deficits, glaucoma, edema or swelling in the legs, which adds weight, causing a person to not be able to move as good. Risk factors: osteoporosis. Literally means porous bone, a condition in which the bone mass or density is less than would be expected for a person of a given age. Other risk factors are 65 years and over, you're thin, early onset of menopause, low calcium diet, excess alcohol intake, low blood pressure, visual deficit macular degeneration, Parkinson's disease, Alzheimer's disease, fear of falling. You're female, white or Asian, family history of a fall, smoker, swaying when walking, foot disorder or problem, lack of exercise, and weakness in the lower extremities, prior stroke, osteoarthritis of knees and hips. So what can you do to prevent falls? Brown bag test. Talk to your doctor and pharmacist once a year about your medications. Multiple medications can cause dizziness, drowsiness, and balance problems. Just look at the side effects on your medication list. Tell your doctor if you experience vision or hearing loss. Also, have you or those around you noticed a change in your hearing? Dizziness can occur with hearing loss. Set up an appointment to have your hearing checked. Have you or those around you noticed a change in your vision? Seeing obstacles in the first step and avoiding a fall. Keep your glasses clean. Have your eyes examined once a year. Make sure you wear your glasses when doing the stairs. If you have fallen in the past year, especially if you have fallen 2 or more times in the last 6 months, tell your healthcare provider and describe how you fell. Do you wear floppy slippers or a long bathrobe? What you should do is wear well-fitting slippers with non-skid soles. Avoid night clothing that drags on the floor, and keep your robe tied. Tell your healthcare provider if you feel weak in your legs or have any other problems with your legs or feet. Do you have trouble with reaching overhead? What you should do is put commonly used things on shelves that are easily to reach, and if you must reach overhead, keep a sturdy tool handy, such as a reacher or grabber, picking up objects up from the floor. Plan ahead, move the object closer to something sturdy that you can hold on to, or again, use a reacher. Do you have troubles getting in and out of the bathtub? Consider adding grab bars to the walls or using a tub seat to assist with bathing. Non-skid tub mats and a handheld shower can also be useful. Getting in and out of a chair. Avoid sitting on low furniture. Chairs with arms make it easier to get up and out of. It's especially difficult to get in and out of couches or chairs that have soft cushions, so avoid those as well. Do you have trouble walking without holding on to something? If you feel unsteady without holding on to something, you may need an assistive device such as a cane or a walker. Things to consider in your home. Perform a home assessment for safety to include lighting, flooring, and furniture placement. Do you have throw rugs around? Throw rugs pose a tripping hazard. Tack down or remove those. Stairs without rails. Using handrails to go up and down the stairs is easier and safer, especially if there's handrails on both sides. Do you have clutter in your walking space? Clutter such as shoes, electrical cords, magazines, boxes are a safety hazard. Keep pathways clear. Dark hallways or stairwells. Improve the lighting, can reduce the chance of falling. Consider adding night lights where overhead lighting is lacking. Add bright tape strips to the edge of a stair. Always keep a charged flashlight near your bed. What you can do. Call us to perform a free risk assessment interview, as well as outline ways to minimize your risk. A free home safety inspection to assess overall safety, as well as things such as lighting, flooring, and furniture placement. So the next step, Safe at Home Healthcare exists to help families and friends care for the ones they love. We provide around-the-clock in-home personal care services in the Chicagoland area. For more information, you could call us at Safe at Home Healthcare, 630-890-1268, or visit us at www.safeathomehealthcare.com.